Yields back. With that, I'll ask the gentleman from the great state of Alabama, Mr. Moore.
Hey, thank you, Mr. Chairman. The Trump administration reversed several of the Biden-Harris BOP-related policies through executive order. Most notably, President Trump signed an executive order 14168 requiring that all federal inmates be housed according to their biological sex and ending any provision of taxpayer-funded gender-affirming care for any federal inmates. Mr. Patel, how did the previous administration of the Bureau of Prisons justify allocating limited taxpayer resources towards gender transition?
In all honesty, sir, I couldn't answer that. I don't know what their justification was.
What would be a better use of those funds?
Well, what I will say is that I strongly support the current executive order that housing should be based upon biological sex. I think that there's a lot of agreement across multiple corrections systems, not just at the federal system, that's the way to go. I believe that's the way California currently operates. And if you can get agreement between an executive order from the Trump administration and Governor Newsom's administration, there's probably, we can safely say there's some bipartisan consensus on that issue. And I do think that for facilities, both security and for the safety, especially of the inmates, that's the correct policy.
Yeah, I would agree 100%. And one thing you mentioned in your testimony, and we looked at this in the state of Alabama, is the in-home confinement as opposed to having them locked up in a prison, a federal prison in this case.
Yes, sir.
Can you elaborate a little bit on the cost effectiveness of that? I think that was something Bill Barr and the CARES Act, they kind of came out with. And it seems like to me that makes a lot of sense for the taxpayers and for the inmates. Yeah,
I agree. The cost savings there is enormous. It's just over $44,000 a year to house an inmate in a federal correction institution today. I don't have numbers handy, but I'll get them to you on exactly what the differential there would be on home confinement, but it is substantial. And as long as you approach that topic from a public safety standpoint, that you're very careful about who moves to home confinement, I think that the bar requirements were very well thought through. I think that they also ensured that we maintained the rehabilitative piece of corrections is extremely important. The punitive piece is also important, and I think requiring a significant portion of their sentence to have been served was what Mr. Barr was trying to get at with that piece. So I think that's a very viable option, given that 54% of the current federal prison population is deemed low risk to recidivate by BOP's own pattern tool.
Yeah, I agree 100%. Like I said, if they're nonviolent, maybe there's an opportunity to revisit their case and say, hey, you can be confined at home. And in the state, when we were doing this study, it seemed like we could house them for a month for the cost of one day in a prison. And so we were looking at it as we were overcrowded as well. So a real quick question, Mr. Potter, I want to ask you this. And the 119th Congress has already acted with the introduction of H.R. 1046. It's actually the Mark Fisher Memorial Act. Are you familiar with that?
I'm not familiar with it.
Okay, what happened, we actually had a Bureau of Prison employee that was just going through the mail, and I think it had so much fentanyl on it that it killed him. And so we're looking at ways that we can actually have this mail screened off-site, and so I think that probably is something we're trying to get. I think we've got 56 co-sponsors right now, so we're working on moving that through. So hopefully we can make some. Any of you familiar with that at all? Okay, it's something they asked me to talk about, and I wanted to make it aware to the panel that we're talking about that. But Mr. Wilde, what is the number one thing that you see when what really changes when you start meeting with folks who are incarcerated and through your process? What do you think is the most impactful thing that we can do to help folks not recidivate?
So Prison Fellowship utilizes what we call an ecosystem model. It's recognizing that within a correctional environment, there are multiple stakeholders. And so through programming like the Prison Fellowship Academy and the Warden Exchange, correctional leaders as well as the incarcerated population can actually go on parallel journeys and not look at one another as the problem, but both become participants and partners in how do we create a more rehabilitative and constructive culture to both live and work in. And so we utilize all kinds of programs that bring multiple stakeholders together.
Do you see your recidivism rates drop dramatically?
Our recidivism rate within the state of Texas is a reduction in over 50% from a control group within that state.
One of the things we've done in Alabama, and it's actually skills training in prisons so that as those individuals are incarcerated, they actually develop a skill, whether it be a mechanic certification, HVAC, honestly, all kinds of industry they can go into. We've seen that have a tremendous impact as well as faith, I think. So with that, Mr. Chairman, I'll yield back. I'm out of time.
Thank you.
And Mr. Chair, I do have a unanimous consent.
Without objection,
Under Trump, U.S. presidents offered gender-affirming care. This is a New York Times article from October 16,
Without objection.
2024. Thank you.
next, if I've got this right, ranking member, we have Mr. Raskin from the great state of Maryland.
Thank you, Chairman Van Drew. Mr. Potter, is there evidence that private prisons are run better than Bureau